WPSD Local 6, your breaking news and weather authority. This is Local 6 at 10 in high definition.
We hope we never need to go to the emergency room, but if we do, many of us count on insurance to help pay the bill.
Major insurance provider Anthem says it's cutting back on what they'll pay. The move impacts more than 73 million people. Under what the company calls its avoidable ER program, they can refuse to pay for certain services. Local 6's Blake Stevens joins us with tonight's top stories. So Blake, how many people make unnecessary trips to the ER?
Well, Jennifer, Anthem says 66% of their patients go to the ER when their doctor's office is closed. And they say a quarter of their customers go to the ER as a first resort. But a study last year found 3.3% of emergency room visits were avoidable. The president of the American Medical Association wrote in a letter, when this was rolled out, Anthem's policy requires that they, the patient, diagnose their acute symptoms at a critical and emotional moment when time be of the essence. The impact of this policy is that very ill and vulnerable patients will not seek needed emergency medical care while bluntly their conditions worsen or they die. The president of the American College of Emergency Physicians says this forces people to play doctor and determine them from a necessary trip to the emergency room. Now, here are some things Anthem considers non-urgent. Chest pain while breathing, which can be a blood clot in a person's lung. Acute conjunctivitis, that can cause blindness if it's caused by gonorrhea. Influenza or the flu, which kills thousands every year. And let's not forget, many times indigestion can feel like chest pain. Experts say emergency symptoms can feel minor. An argument you definitely can't make against Anthem: going to a doctor's office is cheaper than the ER. The company is promoting alternatives. They include urgent care centers, which average around $143 per visit, walk-in doctor's offices at $124, retail health clinics cost around $72, live health online is $49, and Anthem suggests a trip to the emergency room costs around $1,404. Now let's pretend on the left, this is all the Anthem customers that go to the emergency room. The company says 27% of those people could be treated at an urgent care center, a walk-in clinic, or a retail health store. That could save them $4.4 billion. Now, this January, the company rolled out exceptions. National Public Radio says they now look at if a person was directed to the ER by a provider or an ambulance, if care was received by a patient under 15 years old, and if the ER visit occurred over a weekend or over a major holiday. Jennifer.
Well, this policy was first tested in Kentucky in 2015. Now it's in several other states, including Missouri. Missouri Senator Claire McCaskill says she believes this policy violates federal law. She sent a letter to federal agencies saying, in part, patients should never be in a position of correctly diagnosing their specific emergency medical condition before seeking professional